A painful hip gait pattern could look like a normal gait pattern, but there'd be increased pain, and no one wants that. The pain would occur every time there is weight bearing on the affected lower extremity, so in this case on my right leg. In an effort to avoid the pain in their hip, people will generally lean over the painful side during stance. Because it's painful, they will typically spend significantly less time over that leg, and most of the time will be spent on the non-painful side. In this case, that'll be on the left side that is not painful. The equation of torque is force times distance, and by decreasing the distance between upper body weight and the hip joint, there is decreased external torque in the frontal plane. By leaning over the affected side, there is decreased force needed by hip muscles to keep the hips relatively level. By decreasing the force needed to keep the hips level, there is less joint compression within the hip joint. Body weight above the hip is pushing down on the joint, but the other component that adds to the compression is the amount of muscle activation by the muscles surrounding the hip. And by decreasing the amount of muscle activation surrounding the hip, there would be decreased joint compression and therefore decreased pain. Now let's look at it with a little beatbox. Ah, boom, boom, ah, boom,